First things first, pack light. I can't be having all that heavy stuff on my back, child. What's up guys, it's Riley and I'm here with the video for you guys today. I am a 5th semester nursing student in an accelerated program, and today I'm going to give you my must-haves and what's inside of my clinical bag. So let's see what I take to clinical, and I'll give you guys some tips as well and give you guys some thoughts to keep in mind when you are getting prepared for a clinical. So let's just get straight into it. Item number 1, your badge. You're gonna need your badge. Like, the last thing you need is to get to clinical, you forgot your badge, and then you get sent home. Like, don't be that guy, don't be that girl. Like, make sure that you have your full uniform on, that you have your badge ready, and even if you want to even go so far as to have an extra set of scrubs in the car, because you just never know. Then with the pandemic, they're really strict right now in hospitals about who they're letting in, so you really want to make sure that you have your identification, because you just want to avoid all that. And it's really difficult for schools right now to be getting contracts with hospitals to have their students, you know, do clinicals. I know a lot of people who didn't get clinical time because of the pandemic, so you want to make sure that you don't, you know, hinder yourself from being able to get the full experience that you need. You make sure that you have your badge and that you come well prepared. And also, when it comes to the badge, it's always cool to just keep just reference cards or anything like that when you, like, for when you need the information, to just quickly refer back to something quick, like just for quick stuff. You can't be sitting there reading your badge. But with me, I have Spanish phrases on my badge. It's good to just keep this on my badge personally, because I work with patients who are mainly Spanish speaking, and so this really helps. So when I'm going into the room, you know, I just have a little bit of, you know, a phrase or something to say, you know, to make the patient feel comfortable. Item number 2, your stethoscope. Your stethoscope. You're gonna need a really, really good stethoscope. And look, I don't know who needs to hear this, but you cannot document that you listen to those lung sounds or those heart sounds if you didn't listen to them lung sounds or them heart sounds. Like, you are going to need your stethoscope. Your physical assessment is your bread and your butter. That is your foundation, and it starts with your stethoscope. You are going to have to look, listen, feel, and you're gonna need this. So this is the one that I have. It is a Littman. Let's see, it's a Littman. Please don't mind my nails. Those are coming off tonight. With this item, you are going to need it all day throughout your shift. You're going to be doing reassessments. You're going to want to listen to those lung sounds. You're going to want to listen to those heart sounds. And it's just a super important tool. This is like not something that you want to leave. Like, continuing on the topic of physical assessment, next you are going to want to have your pen light. This is like my must-have right here. Like, pen light, physical assessment, like I said, physical assessment, it's everything. So when you have, I'm looking at my notes too, by the way, so if you see me looking over, I'm looking at my notes. So when you have your pen light, you're going to want to do your neuro checks. Depending on what the patient is diagnosed with, you can check the nose, you can check the mouth, you can check the ears, like everything, honey. Like, this pen light, you know, it comes in handy. And then, like, say the patient is asleep and the room is dark, the lights are off, and you just need to go in and check a line or something like that. Just any sort of light, like, will help you get around the room without having to, like, startle the patient, wake the patient up if you don't have to. And this one in particular, my friend Crystal bought it for me. Thanks, girl. It just clips onto your scrubs. I don't know, it's not clipping, but yeah, it just clips onto your scrubs, and you just go. You do what you gotta do. Like, you gonna get done what you gotta get done, okay? So your pen light, very, very important. Item number 4, and if you haven't noticed already, physical assessment is everything. I'm gonna keep saying that all day because it's like, that's your foundation. It's everything. A watch. I don't care what kind of watch you have, your Apple Watch, if they let you wear it, or just a regular little clock there, like this one clips on to the scrubs or on your badge, but you are going to need a watch. For example, when you're doing your physical assessment, you have to count the respirations. You can't just document 16. I know it's very tempting. You can't just document that. You have to actually count your respirations. You might want to feel a pulse. There's so much things you could do with your time. When you're calling a doctor, keep in mind, it's always important that you're gonna wanna write down the time that you talk to the doctor. You're gonna wanna write down their name. And trust me, if you don't do that, you might get chewed out. So make sure that you're being very purposeful. Make sure that you're being accurate with your documentation, that you're documenting your time, when things happen, when things were communicated, so that you can be on top of your game and know what you're doing. Trust me, I'm dropping gems right now. I'm dropping gems. Time management is definitely everything. You are a leader, you are a professional. Nobody's gonna be down your neck telling you, oh, this is due at this time, this is due at this time, let's go to lunch. No, no, no. Like, you're literally going to have to be on top of your time management. Make sure that you're documenting effectively, documenting your times. I taught the patient at this time. This is what I taught the patient. I called the doctor at this time. This is what the doctor said. This is the doctor's name, etc., etc. So you want to make sure that you're getting into the habit of being meticulous and making sure that you are covering all of your bases. So you're getting this good physical assessment, you're being thorough, you got all this information. Well, you're gonna need something to write with, and you're gonna need something to write on, okay? What I do, depending on how many patients I have, like, it just really depends on like the level of care or the amount of patients that you're gonna have, but sometimes I'll have one sheet of paper. Sometimes I'll have my brain. And so this is the book that I used. I got it on Amazon. It's just a book where it keeps all of your brains organized. And here you can see it. I have this notebook. It's very compact, plain sheet. You can write whatever you want, whenever you want, and that's that. You're gonna wanna have your pens. Make sure that you have the pens that click, because in the moment you could be like doing your task and be loaded with tasks, but then you might hear the nurse or the doctor or the dietary or social work just say something that you just need to quickly write down. And then you're like, you're trying to fumble with trying to take the pen top off. No, you want a pen that's gonna click. Okay, what you say? Boom, write it down. You have everything, you're ready to go. And then if you learn something, that's also a good opportunity to quickly just, jot it down, put it away, and continue on with your day so you can go back and review it later. And last, a highlighter. You're highlighting any changes, you're checking your orders like constantly throughout the day, and anything that you need to update or pass over to the next shift, whatever the case may be, it's all here. Because you wanna be very precise with what you're gonna give in your report or what you're gonna tell to your instructor if they do ask. Number 7, reference manuals. So let's just be very clear. You're not just gonna be sitting there in clinical reading, like that's what class is for. That's what your study time is for. And if you want the full experience, you're not gonna be sitting there reading a book while you're in clinical trying to figure out what to do. Like, if you don't know something, you need to say it so you can learn and watch. You will never forget that, because you're put on the spot and it's gonna stick up here for you. And then you get that personal one-on-one with your nurse where they can teach you how to do a certain skill or what's going on with the patient. But I like to just ask questions, catch the doctor. Oh, can you explain this if you don't understand? Because that saves you a lot of time rather than trying to be reading a full manual when you have stuff to do. You're a nurse. Like, once you step on that floor and you take that report, those are your patients. It's not, oh, my nurse said. No, that's your patient. So right here, I have a med-surg notes, like just a quick guide. And this helps to just like, you flip through, you find anything, like whatever you want. Next, physical assessment. You can refer to that if you're listening to anything on the patient, or if you see anything on the patient and then it doesn't seem normal. So then you could just quickly reference and you're like, I heard this or I saw this, like what could it possibly be? And then you go back, you report it to your nurse, you report it to your instructor, and they're like, oh, you good, you good. And lastly, the clinical Bible. You're gonna need a drug guide. Do you think every nursing student memorized this entire book? Medication administration is so important. Like, you really need to pay attention. Make sure that you're doing your 6 rights. Make sure that you're understanding what you're giving the medication for. Why is the patient taking it? What will it do to the patient? What do you watch out for after? What do you check for before you administer the medication? Any drug book, I'm not saying that you need to get every single thing that I have. These are just tips and, you know, items that you can look into for yourself. This is the one that I have. And yeah, make sure that you keep your book with you and you're referencing it often, especially before you give medication. Number 8 and 9, scrub hat. Goggles. I just put it on like this. Scrub hat and goggles. This is not a must for you guys, but this is just one of my personal preferences, to be honest. Like, with the scrub hat, it's just for extra protection. It keeps my hair back and it keeps you looking professional if you have a bad hair day. Those who know, those who don't, don't. If you get it, you get it. But yes, this is always gonna come in handy. And then your goggles, you really never know if you're gonna have a patient who requires wound care or something, like some sort of task or skill that's gonna be required where fluids are gonna be flying all over the place. So this for me is just that extra protection over my eyes if I'm going inside of a room where I could be possibly exposed to like bodily fluids or anything of that nature. Number 10, shears. Shears. I don't know what it is about these things, but you are going to need them. Like, literally, you're gonna use these at least once every shift. Like, you could be having to deal with IV lines or cutting open a medication bag, IV fluid, like cutting tape. Like, you just never know when you'll need these shears. And literally, if you have these shears and a nurse needs the shears, they are going to love you for saving their lives when you give them these shears. Because literally everybody's like, you got scissors? You got scissors? And you're like, here, I got scissors. And they're like, yeah, you got scissors. And then you cut away and the day is saved. You feel me? So make sure you have your shears, some good ones too, because you're gonna be cutting through some thick stuff. You just never know. Number 11, hydration, nutrition. You're caring for your patient, but are you caring about yourself? Are you caring about yourself? That's the real question. You can't take care of nobody if you've done passed out on the floor. Okay, so make sure that you guys are staying well hydrated because you will be on the move. I'd even go so far as to say take a little granola bar or something, you know, get a little bite in. Self-care is so important as well, and just simple things like water is just really important when you're on a long shift, a 12-hour shift. You're on your feet all day. Come on now, you're gonna have to drink some water. Number 12, and this is the very last but not the least, hand cream. You don't need any specific hand cream. You just need something that's gonna keep you moisturized, because if you're practicing proper hand hygiene, you're gonna be washing them hands all day. You're gonna be hand sanitizing all day. When you go in the room, out the room, you're gonna be doing your hand hygiene. And with the cold temperatures in the hospital, your hands are gonna go ahead and get a little bit ashy, dry, crackly. We don't want that. We want nice, clean, manicured nails. Don't judge me. We want nice, clean, manicured nails, nice, soft, smooth skin, and we're gonna be taking care of ourselves. Again, self-care. You have to take care of yourself as well. We know that you wanna go help people and you will be amazing. We're all gonna be amazing. We're gonna help people, but we gotta help ourselves too. So that's everything for today. I hope that you guys took away some gems from this video. Those are my clinical must-haves, and that is what you will find in my clinical bag. Thank you guys for watching. and have a good day. If you have a comment, drop it down below. You know where to find me.